My doctor called me. She says, when you get home, can you please call me and have your husband there? She said, I'm sorry, I have to tell you have brain cancer. And I was just like, oh no, 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 no.
And so began Lana's journey, like many other San Joaquin County residents, traveling out of town for cancer treatment. It's been 9 years, and Lana is still making that journey to UCSF for life-saving treatment, sometimes weekly, sometimes monthly, leaving behind her children, her community, her support system.
Oh, it is stressful, especially because traffic is very unpredictable.
Stormy weather is being blamed for a tragic accident.
So a 90-mile drive could be 3 hours. So then you're late for one appointment, then you're late for the next appointment. It's nerve-wracking. There's nothing easy about it, leaving town and spending the whole day. And my chemo treatments were 6 hours long when I started. Chemo's barbaric. Barbaric. They almost kill you to save you. Especially when chemo makes you just so tired and sick, you know, getting back in the car.
Adventist Health Lodi Memorial wants to change that. We want to bring state-of-the-art detection and treatment to you here in our own hometown.
The Catch It Early campaign really started as the idea that we can do better at making sure patients are diagnosed with cancer as early as possible so that the opportunity to have a full recovery is as high as it can be.
So how do we do this? First, we purchase new state-of-the-art imaging equipment that allows early detection of cancers. Very expensive equipment like a new MRI, CAT scan, and biopsy machines and software. Patients' comfort will be enhanced and images will be processed more quickly.
The images have more spatial resolution. That means they have more detail. We can see smaller things. We can see things that we might not have seen otherwise.
Second, we'll be establishing a cancer panel of experts in the field who will meet with patients in one location within 2 weeks of diagnosis to develop a specific treatment plan. This will dramatically speed up treatment and reduce that paralyzing fear of the unknown.
Where the medical oncologist, the radiation oncologist, and the surgeon, who are all local, will be able to see the patient and come up with a plan of care.
1,800 new cancer cases are detected each year in San Joaquin County. Breast, colon, and prostate cancers are the most prevalent. Dr. Cordaji is one of the board-certified physicians that will be on the cancer panel.
State-of-the-art technology, particularly with MRI, will not only allow us to identify prostate cancer more specifically, but also reduce the number of biopsies that we may need to offer our patients.
And finally, we'll be including a patient navigator to the panel. The patient navigator is like a personal coach, walking patients through the entire process to better understand treatment procedures and even providing guidance on sharing the news of your illness with others. It was just this type of cancer panel that Edith experienced when she sought treatment at Stanford.
All the doctors came in together and they had mapped out a plan of treatment for me. So when I met with the panel and we discussed all this, they said, do you have anything that you would like to ask? And I said, yes. When can you schedule surgery? Because I don't want to wait any longer than I have to. After that meeting, I met with the surgeon and I had surgery in a week and a half. And we continued going to Stanford for 13 years.
Both Edith and Lana have lost track how many times they've made trips back and forth for treatment, and they can't begin to count the miles and hours of stress and discomfort. Dr. McLaughlin understands this all too well. His 5-year-old daughter is also fighting cancer out of town.
Cancer is scary, and people feel like they need to go to the universities because that's where they're going to get the best treatment, best equipment that's available today. And that's just not the case. With the new equipment that we're getting at Lodi and having the oncology panel, patients can be rest assured that they're going to get the best coordinated cancer care possible.
To have the level of care that either UC Davis or UCSF has in Lodi would be unbelievable. It would be so much calmer, smoother, easier, because it's really, really, really an awful, awful situation to be in. So it would make all the difference in the world.
Let's beat cancer together in our own community. By supporting Catch It Early, you're saving lives right here in Lodi.
I just want to say there is life after cancer, and I guess I'm living proof of it. I've had almost 30 years of an active and productive life since cancer.